All right, class, let's get started on our injury evaluations PowerPoint. Okay, so we are going to start with how to perform a clinical evaluation. So there are a few acronyms that we use. This first one here, called HOPS, is how we are going to be performing that evaluation. So that stands for history, observation, palpations, and stress or special testing. For injury evaluation, why are we doing it? What's our purpose? Our purpose is to determine the cause, type, and severity of the injury. So cause, how did that occur? Type, what type of tissue has been injured? So is it a muscle, bone, a ligament? And the severity, how severe is that injury, and what are our next steps? We perform two types of injury evaluations as an athletic trainer. They could either be on-site or clinical or off-site evaluations. So on-site is going to be a very, very brief assessment of the cause, type, and severity, and that's just going to be right on the field or court when we first run out to that injured athlete. And then our clinical evaluation or off-site is a very detailed assessment of that cause, type, and severity. This is usually conducted in the athletic training facility, and it's going to follow either the HOPS or the SOAP format, S-O-A-P. And that stands for subjective, objective, assessment, and plan. So we use this to evaluate each athlete that comes in, and it's a little bit different than HOPS, but you can see an example of it on the right. We are going to go over what each of those letters mean in that acronym. And generally, the situation is that an athlete goes down in whichever sport they're playing. So that's either on the field, on the court, out on the track. No matter what, the athletic trainer is the first responder. So we don't call 911 or EMTs, EMS, unless we need transport to the hospital. But we are fully equipped and taught how to respond to any sort of traumatic injury. So whether we need to perform CPR, use an AED, if we need to spine board someone, concussions, bleeding, broken bones, splinting, we do all of that on site. In our primary survey, so in our on-site evaluation, that first contact with the athlete, we need to first and foremost make sure that we're going over the ABCs. So that's airway, breathing, and circulation. That's the very, very first thing that we check. Then from there, we're going to look for bleeding. So if it's very obvious or apparent blood loss, then we know that that athlete could go into shock or have some hemorrhaging, and something else could happen that's more emergent. So after we establish ABCs, we'll look for bleeding or some obvious deformities or gashes or lacerations on the body. In our secondary survey, so once we've determined that that person is stable, they're breathing, they don't need to be transported to the hospital, then we're going to move on and check their head. So we will check ears, nose, eyes, especially the facial bones and mouth and teeth to make sure nothing was broken. And then we will perform a cranial nerve assessment. So you guys do not need to know or memorize the table below, but this is just an example of some of the testing that we do on an athlete with a suspected head injury. Also, in our secondary survey, we are going to start palpating the head and neck. So we are looking for specific things like depressions or deformities that could indicate a skull fracture or maybe a facial fracture near the eye or cheekbone. We're also going to look for bruises, deformities, bleeding, anything that could indicate that that athlete has had a traumatic brain injury. Then once we've cleared the head, we want to go down on into the clavicle and arms. So we will check that collarbone. We are going to look for fractures and deformities. We will also test grip strength and sensation. That's to make sure that their nervous and circulatory systems are working properly and they still have full movement, strength, and sensation throughout their arms and hands. Next, in the secondary survey, we will move on and start palpating the torso and abdomen. So we'll go over ribs, sternum, upper back, and then into the abdominal region. So trying to palpate all areas and different organs. We're not going to go over it super in depth in this class, but we're looking for things like rigidity or bloating in the abdomen to make sure there's no internal bleeding. And then from there we will go down, palpate hips, pelvis, lower back, and then do the same sort of testing on the lower extremity that we did for the upper. Also in the secondary survey, we will check sensation in the fingers and toes, and that's to make sure that the whole nervous system is in check and there's nothing going on neurologically. And then we will also check something called capillary refill. So this is a response that you will check in the fingers and toes. That's what's happening in this picture on the top right. So what that means is if everyone takes their fingertip, with your opposite thumb, put a little pressure on the end of your fingertip, and then when you remove the pressure with your thumb, it should leave a little white space, and then your fingertips should fill in very quickly back to your normal skin tone on all of your other fingertips. So we're just putting pressure on your fingertip. We're trying essentially to take the blood out of that area, and then once we remove that pressure, it should fill back into normal color for you. So if it does not fill back in, that means that the circulatory system is not working properly, or there's a slowing or stoppage of blood flow. As long as it fills back within the first about 2 seconds, then that's considered normal. And then after we've checked the body, we're going to go into questions about head trauma. So asking them pretty obvious questions that should be easy for any athlete, but if they have a head trauma, they might not have the correct answers. So starting with what's your name? Do you know what happened? Do you remember everything? Where is it hurting? Do you know the score of the game? What venue are you playing at today? All sorts of questions to make sure that they're still functioning fully. Secondary survey, we were also trying to determine the level of consciousness and alertness. So if they're fully conscious and alert, we don't need to call 911, take them to the hospital, anything like that. But if they're not, then there's going to be other steps that we have to take. So if the patient is either taken to the sideline or to the sports medicine facility if they're stable. And then we're going to do certain vital signs like taking their pulse and respiration. That way we can track it over a period of time. And then we'll do a much more in-depth evaluation. Okay, we are going to perform this subjective exam. So that's that first S in SOAP. We are going to start with medical history. So this is everything that the athlete can tell you. So this is not you observing anything. These are just questions about the injury and the athlete's overall health. So where does it hurt? When did it happen? Was it recent? Is it chronic? What type of pain are you feeling? So it could be dull, it could be achy, sharp, stabbing, tingling, or feel like pins and needles. What makes the condition worse? What makes it better? Any unusual sounds that you're hearing like pops or clicks? Do you remember what happened? How's your nutrition? How's your hydration? How are your sleeping patterns? Really, we're trying to get a full picture of the athlete, not just ask specific questions about, their shoulder that's hurting, making sure we get the full image for that athlete. All right, then we move on to objective. So in our HOPS assessment, we did H for history, now O for objective or observation. So this is everything that you are going to see and observe on the athlete. So we're going to look for general observation. So their overall demeanor when they come in. Do they seem happy, sad? How are they responding to questions? Do they look like they're in a lot of pain with their facial expressions? How they entered the room? And then we're going to look at some structural or observation. So that's their posture, their gait analysis. That means if they're limping or walking differently because of pain or injury. And then our specific inspection of that tissue. All right, during our objective exam, we also do something that's called clearing of a joint or clearing of an area. So we want to make sure we do this above and below the sites of the pain or injury, and that's just to rule out any involvement of any other sort of injury or illness that's near their pain. And then we will also do a neurological exam, which is sensory, motor, and reflexes. All right, in the objective exam, we will also perform a functional assessment. So the purpose of this is to determine the type of tissue that's injured. So we have all different tests to make sure we can test muscle versus ligament versus tendon and really figure out what's going on. So we will test contractile versus inert tissue, which I'll go over in a minute. We will go over active versus passive range of motion. So active range of motion, let's take that shoulder that was bothering the athlete. Can they raise it up fully in front of them or to the side? And then passive range of motion would be that athlete completely relaxing the shoulder and me being able to move it without their activity of their muscles. And then we'll also look at if they can resist any movement. And then we'll talk about activities of daily living, or ADLs. That's making sure that they're not having issues going through their normal daily life. We deal with athletes that are students, who have jobs, who are, helping out at home. So we want to make sure that they can turn that doorknob with their wrist, lift up a heavy backpack, and they're not having any issues at home. And then also going through their functional movements of the sport. So seeing if we need to hold them out of certain specific movements depending on the severity of their injury. All right, so the difference between contractile and inert tissue. The only type of contractile tissue in the body is going to be muscle. So that's the only tissue that will contract and move on its own, whereas everything else that we study in this class is inert tissue. So looking at bones, ligaments, cartilage, tendons, fascia, all of that is considered inert tissue. All right, so in our objective exam, we will perform those special tests. That's to determine the type and severity. So if, for instance, someone has a suspected ACL tear, we will perform what's called a Lockman's test. And that's a certain test that's going to stress the ACL, and we'll look for laxity, tension, stability. So seeing if it's loose, if there's extra movement, and then comparing it always to the other side. And then we will also do special measurements. So this is things like taking goniometry or girth or length measurements with a tape measure to make sure that we're giving ourselves some numerical data. That way we can track it over time throughout their rehabilitation process. All right, and then we will also go through palpations. So again, this is touching the injured area and trying to feel for any sort of deformity. So we want to make sure we're not going in with super heavy hands and just putting a ton of pressure on that shoulder. We want to start very superficial and light, and then we can work our way into palpating the deeper tissues like the muscles, bones, and ligaments. Because if that athlete has pain, you're going to cause them a lot of pain if you don't start really light and slow on that shoulder. For the skin, we're looking for point tenderness, temperature, texture. That second layer, subcutaneous fat layer, we could look for fatty tissue, lumps, any fluid or swelling. In the muscles, we're looking for the atrophy, tone, tenderness, if that muscle's in spasm, any knots. And then the bones, we're looking for the obvious, which is that bone fracture. If we can't see it, there are ways that we can palpate and feel it very effectively, and different tests that we can do without an x-ray. We're also looking for a dislocated joint, or if that person has any pain on a bone. All right, and then the A and the P in our SOAP note. So we went over subjective, objective, now assessment and plan. So assessment just goes over what we think is wrong or injured or hurt on that athlete. So now we can answer the cause, type, and severity. So the cause of it might be the athlete got tripped up in their soccer game. The type would be an ankle sprain, so we know that that's a ligament. And the severity would be first, second, or third degree. So we'll go over that a little bit later. But first is more mild, third is more injured. And then P is the plan. So that's just coming up with your own treatment plan based on all of these findings. So first and foremost, can the athlete walk around? Can they practice? Can they play in the game? And then what rehab or extra exercises or help that athlete might need along the way. And that's the end of our first lecture.